Good evening, everyone. I'm Jennifer Smith, and I'm a science communicator at Wisconsin Sea Grant. Welcome to tonight's Lake Talk. Tonight, we're concluding our spring series with a look at harmful algal blooms and how to stay safe, including information on how the state of Wisconsin manages this issue and works to keep people and pets safe. Our speaker tonight is Jordan Murray. Jordan is a Wisconsin Water Resources Science Policy Fellow. This fellowship is supported by both the Wisconsin Department of Health Services, also called DHS, and UW-Madison's Aquatic Sciences Center, which includes the Sea Grant program. As part of this fellowship, Jordan serves as Harmful Algal Blooms Program Coordinator at DHS in its Division of Public Health. Talking about harmful algal blooms, or HABs as they're commonly known, is a timely topic since we're heading into blue-green algae season as temperatures get warmer. In fact, it was a record high of 93 today in Madison, and it's only May 12th. We all want to get outside this summer and enjoy the lakes and other bodies of water, but doing it safely is important. I first talked to Jordan last year for a story that I wrote about her fellowship, and I was really impressed by her passion around this issue and her personal story of how she got involved in this work. Because I know she'll tell you more about her background, I won't go into that detail right now. However, I will mention just a few housekeeping details. This event includes time for your questions and your comments, so feel free to drop those at any time in the chat and we'll get your questions answered. And for those of you who may not be familiar with Sea Grant, we're one of 34 such programs in coastal and Great Lakes states, and it's our 50th anniversary year of working on Great Lakes issues. We're based at UW-Madison, and we also have field offices with staff in places around the state, including Manitowoc, Green Bay, Milwaukee, Superior, and Kenosha County. But I know you're eager to hear from Jordan about tonight's topic, so without any further ado, I will hand it over to Jordan Murray. So thanks for being here, Jordan, and take it away.
Yeah, thank you so much, Jennifer, for that introduction. My presentation today will focus on the health effects associated with exposure to blue-green algae or cyanobacteria, and the public health approach to dealing with related illnesses in Wisconsin. I'll also talk about how you can stay safe and enjoy the lakes this summer. But before I dive into this presentation, I just want to talk a little bit about my personal connection to blue-green algae and how it led me to my current role. So I was born and raised in Toledo, Ohio. I've lived there for almost my entire life up until I moved to Madison, Wisconsin, close to a year ago now. I put this slide in here mostly just to show off pictures of my dogs who are back home in Toledo, but I also thought showing a collage of pictures of my friends and family from Toledo really encapsulates the special connection that I have to the city. And for those of you who are not familiar with Toledo, it is part of Northwest Ohio and it borders Lake Erie. Toledo is known for its glass and auto industry, the Toledo Mud Hens minor league baseball team, and the University of Toledo, which is where I earned my master's in public health degree last year. Toledo also has 16 beautiful metro parks, a renowned art and glass museum, and it's home to Tony Paco's, an authentic Hungarian restaurant that was made famous by a Toledo native and MASH star, Jamie Farr, who references Tony Paco's in several episodes of the show. But unfortunately, Toledo is also infamously known for the blue-green algae blooms that develop in Lake Erie each year. And in 2014, Toledo issued a 2-day ban on drinking and cooking with tap water due to the toxins found in the drinking water. These toxins were a result of an algal bloom that was occurring in Western Lake Erie. And so with that being said, blue-green algae is a public health issue that is very personal to me because of the impact that it's had on my home and my community. This issue kind of sparked my interest in learning more about the relationship between the environment and health, and led me to pursue an education and career in public health. And so now I have this amazing opportunity as a Wisconsin Water Resources Science Policy Fellow to help protect people from the negative health effects of blue-green algae. As the Harmful Algal Blooms Program Coordinator at the Wisconsin Department of Health Services, I've been helping lead our state's public health response to freshwater blue-green algae for almost a year now. And my fellowship, it's pretty unique in that it kind of ties 3 roles into one. So as a program coordinator, I help to ensure that our program is meeting its CDC grant requirements. And in doing so, this requires me to work with a wide range of agencies from the local to federal level, including local health and parks departments, internal and external state environmental and health agencies like the Wisconsin Department of Natural Resources, and federal agencies like the Center for Disease Control and Prevention, as well as the National Park Service. I'm also an epidemiologist and state disease investigator. I help to investigate blue-green algae related illnesses, as well as assess, analyze, and interpret health data. And lastly, I am a health educator. I get to create fun and educational resources and social media posts about blue-green algae and educate others about it too. I have a wonderful mentor team who has really helped me to grow in these roles. And really quickly, I just want to give a shout out to my primary mentor, Amanda Cook. She's featured on this in this picture on the right. She was the blue-green algae public health state lead for about 4 years before I assumed this role. And she is just incredible. So shout out to you, Amanda. All right, so now let's talk about cyanobacteria, also known as blue-green algae. So cyanobacteria are a type of photosynthetic bacteria. They are one of the first organisms, if not the very first, that figured out how to make oxygen. And because of that, they've played an important role in the creation of Earth's atmosphere and water bodies as we know them today. They can be found in most of these lakes, rivers, and streams. Under certain circumstances, though, cyanobacteria can be a health hazard to humans, animals, and the environment. When environmental conditions are just right, cyanobacteria can grow to form what are known as harmful algal blooms, or HABs. These can affect aquatic life and people who use the water for recreational or occupational purposes. Some species of cyanobacteria can produce liver, neuro, and skin toxins that can make people and animals sick if they are exposed. And one important thing that I want to point out is that the species of cyanobacteria that do produce toxins don't produce them all of the time. The signs and symptoms that develop from exposure to cyanobacterial toxins depend on the route of exposure, which I'll get to in a minute, the species of cyanobacteria that we're dealing with and what toxins they produce, cyanobacterial cell and toxin concentrations, and existing vulnerabilities. So certain factors like behavior, body size, pre-existing conditions like skin sensitivities, these can all put a human or animal at an increased risk, not only of becoming exposed, but also becoming ill after the exposure occurs. And people can be exposed to toxins through a few different ways. So ingesting or swallowing water is the most likely exposure route, and swallowing water with toxins in it could lead to gastrointestinal symptoms such as cramps, nausea, diarrhea, or vomiting. Ingestion of neurotoxins can cause symptoms like dizziness, numb lips, and tingling fingers and toes. We don't typically see neurotoxic effects in Wisconsin, and when we do, they're typically observed in dogs. Skin contact is another possible exposure route. If a person comes into contact with algal scum or mats, they might develop a rash, hives, or skin blisters. However, toxins aren't absorbed through the skin and into the body, so they wouldn't cause symptoms beyond skin irritation. And pictured here is a rash that developed on a foot after exposure to harmful water conditions. And this is actually a very unique and interesting case that our program at PHS investigated. And the last exposure route I want to mention is inhalation, which is the route of exposure when people participate in activities like tubing or water skiing through a bloom. Generally, their mouths are open and it becomes easy for them to breathe in water droplets. And when this happens, we might see something like a cold-like illness develop, like runny nose or eyes, a sore throat, or a cough. And our animals are affected by cyanotoxins too. We've seen adverse health effects and even death in dogs, wildlife, and livestock who were exposed to toxins. Animals are especially susceptible because they aren't as easily deterred from smelly green water as humans are. They also tend to be smaller in size, meaning that it doesn't take much toxin to make them sick. And when we hear about, large fish kills or bird die-offs in a water body experiencing a bloom, we can hypothesize that cyanobacteria and cyanotoxins may be playing a role. And in this way, an animal illness during a bloom can serve as a sentinel for human illness. Because animals need a relatively smaller dose to become ill, severe symptoms are more commonly seen in them. So symptoms can include things like respiratory distress and paralysis, as well as seizures, coma, and death. We also see severe liver damage and liver failure after ingestion of liver toxins. And because toxins are fast-acting agents, the onset of symptoms in animals and humans as well generally occurs within minutes to hours following exposure. All right, so now I'm going to tell you a little bit about the Harmful Algal Blooms program here at the Wisconsin Department of Health Services. So our program exists to prevent and manage blue-green algae-related illnesses in Wisconsin. And our ultimate goal is to protect and promote the health of the wonderful people of Wisconsin. Our program started in 2008 because that was the year that the CDC began tracking voluntarily reported cases of HAB-related illnesses. And since then, our staff support has been made possible primarily by CDC fellowships and the University of Wisconsin Sea Grants and Water Resources Institute. For 14 years, we've worked diligently with state partners to investigate HAB-related illnesses in Wisconsin. And this core partnership consists of us, the Wisconsin Department of Health Services, the Department of Natural Resources, and the State Laboratory of Hygiene. And it's always great to put faces to names. So here you can see 3 groups of people who make these partnerships possible. Amanda and I are at the top, grimacing next to a bloom. On the bottom left is Gina. She's our statewide harmful algal blooms coordinator at the Wisconsin Department of Natural Resources. And she's also another one of my amazing mentors. So Gina is our Wisconsin's algae expert. And according to me, she's the world's expert. And on the bottom right here is Dawn. She's our incredibly knowledgeable state lab microbiologist. And so in a nutshell, our program conducts surveillance of the health effects related to HAB exposure. We investigate reports of human and animal illnesses. We coordinate water sampling and analysis. We help local public health issue health advisories and beach closures. And we provide education and outreach to local jurisdictions and the public. So how do these activities fit into a typical illness investigation? Well, first, DHS receives an animal or human illness complaint. We most commonly receive complaints through an online reporting tool on our website, but we also receive complaints via phone calls or emails from the complainant, or through referrals from the DNR, local health departments, lake associations, the Wisconsin Poison Center, and even clinicians. And here's a screenshot of our DHS blue-green algae website. You can get to it by Googling Wisconsin Department of Health blue-green algae. And you'll see at the bottom of the homepage is a link to be able to report a suspected blue-green algae illness. So this method of reporting is very valuable to our program. Nearly a third of our complaints are received through this reporting tool. And in the 14 years of our program, we've received a total of 307 health complaints related to blue-green algae with an average of about 23 per year. I do want to point out, though, that the health complaints shown here include illnesses in people and animals. And so after our program receives the health complaint, we begin the investigation by interviewing the patient or animal owner. What we want to know by interviewing them is, could the illness in question possibly be due to cyanobacteria? Did the person or animal actually have an exposure to a water body? And if so, did the water conditions suggest a bloom? Are the signs and symptoms, their onset and duration, consistent with what we know about HAB-related illness? So these are just some of the questions that we seek to answer by interviewing the complainant. And if the illness sounds like it could potentially be due to cyanobacteria, we usually contact GINA, regional DNR staff, and the local health officer of the jurisdiction where the lake is located in order to brief them on the suspect illness. After we assess the information provided during the interview, we will decide if water sampling is necessary. And to do this, we consult with Gina to gauge her thoughts about whether sampling the water is justified or not. We want to know, is the water still representative of conditions at the time of the person's exposure? So what does the water look like now? How many days have passed since the person or animal was exposed? Have significant environmental events caused, or are they suspected to cause changes to the bloom before sampling? Things like time, weather, and the transient nature of blooms can significantly affect concentrations of cyanobacteria and cyanotoxins in the water to the point where they may no longer be representative. And so if the illness in question does sound like it could potentially be due to cyanobacteria, and if the water conditions are still representative of those at the time of the exposure, GINA will work with regional DNR staff to collect water samples, which, by the way, does instruct field staff to wear rubber gloves during sample collection. So samples are then sent to Dawn at the State Lab of Hygiene, who microscopically identifies and enumerates cyanobacteria in the sample, as well as conducts toxin testing. And after Dawn analyzes the samples, she reports the results back to me and Gina. And finally, we interpret the level of health risk present and take the steps necessary to protect public health. We typically share the water sample results and health risks with the local health officials. Local health can then issue a health advisory, closing or restricting access to a beach or swim area impacted by a bloom. And generally, the local health department will work with the DHS HAB program on appropriate messaging, especially to the public regarding HAB health risks. And on this slide is an example of a health alert developed by our program on the left and a press release from a local health department on the right. All right, and now we're going to dive into some HAB-related illness case studies so you can kind of get an idea of the kinds of illness reports that we receive every HAB season. And we will get started with a human case study. So in August of 2017, DHS received a report of a suspected blue-green algae exposure from the Wisconsin Poison Center. The report indicated that a 17-year-old male became ill with gastrointestinal illness the day after recreating in a lake for about 30 minutes. We interviewed the family the following week, and we learned that the boy and his father had visited a county park where they had entered the water to play catch with a football. Their activities included swimming and dunking each other below the surface of the water. And during the interview, we learned that the father was also ill with similar symptoms. Both men experienced headaches within 1 hour of the exposure. And the following morning, both had developed abdominal cramping and diarrhea that lasted 24 hours. Neither one reported knowing any friends, coworkers, or family who had recently been ill, and neither sought medical care for their symptoms. The reported conditions at the time of exposure were murky green pea soup with a rotten egg smell. And the family also observed 3 dead floating carp near where they were recreating. And by the time DHS was able to reach the family for an interview, testing of the lake water for algal toxins was not warranted, as the water would no longer be representative of conditions at the time of the family's exposure. However, the lake water was tested at the deep hole by citizen monitoring on the day of the exposure. The Secchi depth at this location was 2.5 feet, which was the shallowest reported depth during the 2017 monitoring period. The clarity of the water was murky and the color green. And together, these indicators point to a lake that was eutrophic during that time and capable of experiencing a bloom, especially at a shallower shoreline location. And so in reviewing these cases, we had signs and symptoms, including their onsets and durations, which were characteristic of cases of HAB-related gastrointestinal illness. And in addition, both visual observations by the family and environmental data collected by the local citizen monitoring network suggested that a bloom was present during the exposure. Unfortunately, lab-based data on cyanobacterial cell and toxin concentrations weren't available because the water could not be tested. But in the end, public health classified these cases as probable but not confirmed cases of HAB-related illness. And so now let's talk about some of the animal cases that we've investigated. So in late July of 2017, DHS was notified by multiple sources about 2 dogs that died within 1 hour of each other on the same day after swimming in the same lake. We learned that the dogs had no connection to each other and were owned by different families. The dogs swam at 2 different beaches that were approximately 5 miles apart. We knew that the lake is well known for bad blooms, but no blooms were visually observed the day that the dogs died. And the owner of one dog actually went to the media to warn the public of blue-green algae, which she believed had killed her dog. So what happened? Well, we learned that at Beach a Cavalier King Charles Spaniel was swimming and playing fetch in the water for about 1 hour. The first sign of illness reported by the owner was a loss of balance about 40 minutes into swimming. And during their 10-minute walk home, the dog urinated frequently and had a loose stool. And when they arrived home, the dog began salivating and frothing at the mouth. The dog vomited and eventually became unconscious. The owner reported that at the time of the dog's exposure, the water looked brown and murky with no signs of an algal bloom. And around the same time at Beach B, a border terrier was swimming and playing fetch in the water. He was playing for around 20 to 25 minutes. So the first sign of illness reported by the owner was staggering and a loss of balance about 20 minutes after returning home. And shortly after, the dog began twisting and turning as if in pain, began convulsing, and eventually became unconscious. The owner reported that the water looked brown and murky at the time of the dog's exposure with no signs of an algal bloom. And you might remember this slide from earlier. So in addition to our usual partners, this investigation also involved partnerships with the local health departments, veterinarians, and the local lake association. And each group played a really integral role in the investigation process. So DHS interviewed the dog owners and served as the point of contact between investigation partners. The DNR collected and analyzed water samples at both beaches where the dogs were exposed. And the state lab analyzed water samples as well as the dog's stomach contents for cyanobacteria and cyanotoxins. The local health department did their own collection and analysis of water samples. The local lake association shared results from routine monitoring conducted at one of the beaches on the day of the dog's exposures. And the veterinarians received, examined, and attempted to treat the animals during their ER visits. They performed necropsies and additional post-mortem testing on both dogs in an effort to search for a cause of death. So what were our findings? Well, water collected at one or both sites the day of and the day after the dog's exposures resulted in low cyanobacterial cell counts with either non-detectable or very low levels of cyanotoxins. Stomach contents from both dogs were collected post-mortem on the day following their deaths and were analyzed at state labs for different cyanobacterial toxins. And in both specimens, not one cyanotoxin was identified. Post-mortem analyses and necropsies ruled out cyanotoxin exposure and identified possible other causes of death. So one dog exhibited signs of heart defects and a brainstem herniation, and the other one had abnormally low levels of cholinesterase, which can be a sign of pesticide exposure. And so in the end, these dogs were deemed not to be cases of HAB-related illness. And actually, many of the health complaints that our program receives every year turn out not to be related to blue-green algae after all. And this particular intensive investigation really highlights the importance of diverse partnerships in investigating suspect cases of HAB-related illnesses, and also how high awareness of algal blooms in a community, often affected by them, can result in increased reporting and media attention. All right, so we've just talked about how HABs can affect the health of humans and animals, but now I kind of want to talk about the bigger picture. So why are HABs an important public health matter, and why should we continue to care about them? Well, first, we know that HABs are an emerging public health problem worldwide, with areas all over the globe experiencing problems. And secondly, the warming effects of climate change are projected to increase the severity, magnitude, and distribution of this problem in the future. And lastly, the health impacts from HABs are still pretty poorly understood. Most of what we know about health impacts comes from animal toxicity studies and anecdotal case reports instead of large-scale controlled epidemiologic studies. And therefore, we really rely on people reporting cases to us so we can learn more about the kinds of signs, symptoms, risk factors, and health outcomes associated with HAB exposure. Because having this knowledge will help us to be able to prevent these illnesses in the future. But in order to learn more about HAB-related illnesses, we do need to hear about them. And unfortunately, illnesses are not always reported to us, and there are a few reasons for this. Not everyone is aware of what HABs are, what they look like, that they can cause illness, and what kinds of symptoms exposure can produce. HAB-related illnesses, they're pretty challenging to diagnose. Most symptoms are so vague that they sound like other conditions like swimmer's itch or food poisoning or allergies. HAB-related illness doesn't have a single signature sign or symptom that can kind of clue us in. And in most cases, illness is not severe enough to warrant medical attention. And even in cases severe enough to be seen by a doctor or a veterinarian, the level of awareness of HAB-related illness among medical professionals can vary pretty greatly, and therefore being seen does not guarantee that the practitioner will recognize the illness as HAB-related. There's also currently no commercially available diagnostic tests that the doctor could run, for example, on a blood sample to confirm that your illness was in fact due to HAB exposure. And so together you can begin to understand how all of these factors contribute to a potential underestimation of the number of HAB cases seen not only across Wisconsin, but the country as well. So what can we do to help prevent bloom-related illnesses? Well, we can become familiar with the signs and symptoms of HAB-related illness as well as risky water conditions. We can educate others about blooms and related illnesses. We can report suspected human and animal illnesses to our local or state public health authorities. We can encourage others to report suspected illnesses. And we can report obvious blooms to our state environmental resources agencies. And finally, you can follow simple precautions to protect yourselves, your family and friends, and your pets from any harmful effects of blue-green algae exposure. So try not to swim or allow your kids or pets to swim where water is discolored or where you see foam, scum, or algal mats. Try not to boat, tube, water ski, jet ski, or wakeboard through algal blooms. Shower or rinse off with fresh, clean water as soon as you can after swimming in lakes, rivers, and ponds. And keep your pets out of discolored water or where you see foam, scum, or mats of algae. And if your dog does swim in scummy water, try to rinse them off right away and don't let them lick the algae off of their fur. And always look out for and respect any posted beach closures and health advisories because they are there for a reason. And if you're ever not sure about what might be in the water, it is always best to err on the side of caution. Here at the Department of Health Services, we like to say, when in doubt, stay out. So this information, along with other useful information, is included in some of the great resources that our program offers. So we offer fact sheets on how to protect your family and your pets from the harmful effects of blue-green algae. And we also offer one with a photo guide of specific bloom conditions to avoid, as well as a guide to help you differentiate between harmful bloom conditions and their non-harmful lookalikes. To find these fact sheets and more, you can visit our website at dhs.wisconsin.gov and search algae. And I believe Jennifer will be sending out a follow-up email to everyone who attended the presentation today, which will include links to these fact sheets as well as other resources that our program provides. And we also have a fact sheet similar to the one that I just mentioned. This particular fact sheet is geared towards summer camp directors and staff. This fact sheet is not geared towards the public and not available on our website. So if you would like a link to this one, please reach out to me using my contact information at the end of the presentation. We also have blue-green algae public health signage to help keep people safe from harmful water conditions. You might see some of these educational and advisory signs posted at some of our state's public beaches and boat launches this season. And we recently created and published our newest sign designed to be posted at dog beaches and swim areas in Wisconsin. And the goal of this sign is to inform pet owners to be on the lookout for blue-green algae in the water and also to provide guidance for best practices to protect people and their pets from blue-green algae. And one thing I do want to mention is that not all beaches and locations will have these signs, so it's really important to always assess conditions yourself before getting in the water. And so to recap, please report blooms without accompanying illnesses to Wisconsin DNR at dnrhabs@wisconsin.gov. And remember to include descriptions of bloom size, duration, and location with lake, town, and county name, as well as any photos taken both close up and farther away. And to report a human or animal illness, please contact your local health department or the Wisconsin Division of Public Health by calling 608-266-1120. And also remember that an online survey for reporting illnesses is also available on our website. Great, thank you so much. That is the end of my presentation. I am happy to answer any questions at this time.
Great. Thank you so much for that, Jordan. This is really helpful. And I've put some of the links that you recommended into the chat. And people will get that email tomorrow. Everybody who's attending tonight will get that automatic email tomorrow with some resources. We do have some questions in the chat, so I'll go ahead and start sharing some of those with you. Here's one that I hadn't thought of. Somebody asked, do birds have the same illnesses? Like, have you seen algal blooms affecting bird populations, or is that not something you really get reports on?
Yeah, so I know, so I'm not extremely familiar with how blue-green algae affects birds, but I know there have been reports of birds becoming sick, and I believe dying, like deaths have been reported from exposure to blue-green algae. I'm not sure if this happened in Wisconsin or somewhere else in the country or world, but I know that it has happened and they are affected.
Then there was another question, kind of a human medical nature, and it was in the chat fairly early and you touched upon it later, but just to kind of circle back to this topic, somebody asked that if somebody were to show up to the ER, what tests would rule in this kind of an exposure, and how would exposure be treated if somebody like presented to the ER or a hospital? But then later in the talk, you said that things can vary widely in terms of what providers know about this topic.
Yeah.
So what are your thoughts on this? I mean,
yeah, so
handled, and would people have something happen like human effects so bad that you would wind up in the ER?
yeah, so we have seen that happen where we get a report from like a clinician, or we get a report from a citizen saying they went to the doctor and like the doctor classified it as a blue-green algae related illness. But yeah, as I said, like the knowledge among clinicians and veterinarians, it varies pretty greatly. And if you're not really in a region where there's like surrounding water bodies and blue-green algae blooms occur, like you're, as a physician, you're not really going to be very knowledgeable about those types of illnesses. And in terms of the types of tests that are available, as I mentioned earlier in the presentation, unfortunately, there's no available like commercially available diagnostic test that like a doctor could use to like identify toxins in like your blood or your urine. So this unfortunately isn't widely available to clinicians. I know there are some laboratories within the country who do these types of tests, but like I said, it's not widely available to clinicians, unfortunately. But the way that that our department rules in or rules out these types of illnesses is typically based on exposure. So if we know that there is a bloom occurring when the person is recreating in the lake and they were exposed to the bloom and they reported that to us, then and they had like subsequent illness, then we would kind of assume that their illness was related to blue-green algae blooms. So we also, like, our questionnaire is very, very thorough. We ask about exposure, symptoms. We ask about things that they ate and which could like result in other types of like gastrointestinal illnesses. We also ask about like health history and like differential diagnoses. So all those factors kind of come into play when we're ruling in and ruling out exposure. But unfortunately, that type of information isn't really, I guess, like clinicians don't really take into consideration those types of variables.
Mm-hmm. I'm sure sometimes it's tough if travel is involved too, because, you know, let's say a person sees a doctor in an area where they're not near a water body, but they just traveled from someplace where there was. I'm assuming that kind of complicates the picture of this kind of detection.
Yeah. Fortunately, there's so many factors that kind of come into play, and that's why our investigation process is so intensive, and we ask such thorough questions to kind of get at the like nitty-gritty of their exposure and symptoms.
Yeah.
And then in terms of like treatments. I'm not a medical professional, so I'm not qualified to answer any questions about like treatments or yeah, things like that. But you know, I also don't know if there are available like medications and treatments available for people who do get sick with blue-green algae related illnesses besides yeah, like rehydration and things like that. In terms of like skin rashes, I know topical ointments have been prescribed to try to alleviate the rashes, but it's kind of unclear whether those help or not. So to answer that question in the chat, it's pretty pretty unclear at the moment, unfortunately.
Okay. Here's a question for you about the blooms themselves, and this is my question. I'm just wondering how long, because you referenced these blooms as being transient in nature, and so I'm wondering how long do they typically last? I mean, is there a typical length, you know, or what is the range, and what makes the bloom eventually go away?
Yeah, that's a really good question. So from my understanding, I don't know if there's like a standard length of time that they will persist. I know it depends on various factors like whether there's wind present, if there's like a rainfall. I know that could dissipate the bloom, things like that. I think they last for around a few days, I would say, if conditions are favorable to them. I'm sure Gina from the DNR or Amanda could probably answer that question better than me. But that's a great question. And I think, was there a second part to that?
Not really. I mean, I was just kind of thinking about the transient nature, because I remember you said that in cases where there's water sampling, you know, sometimes like they might not do the water sampling if the conditions of the water body have changed a lot since the person was exposed. Because I'm guessing at that point, the water sampling is not super relevant.
Correct.
The conditions are not similar to, you
Yeah,
know, somebody was exposed a week ago and now it's totally different. You know, so just kind of thinking about blooms as kind of these weird transient, you know, they're not permanent. They're things that kind of flare up.
Right. Yep. Given these environmental factors that can flare up depending on, yeah, whether conditions are favorable or not. Exactly.
I think we have a few more questions related to the kind of the ER exposure. I'm just going to read these. I haven't previewed them yet, so I'll just read them as they are. So the commenter says, we have lakes around us, but never had anyone diagnosed that I am aware of. Is there any treatment other than what is standard for GI illnesses and rehydration? And then I think you had talked about that a little bit. And then the person continues, I'm an ER nurse, so just trying to put my head around it. If neuro symptoms, we would treat like stroke. So yeah, this may be getting a little medical for
and
you to answer, but
yeah, I don't think I can answer that because I'm not. Okay. And also with that, like neuro symptoms are not typically observed in humans, like I had mentioned earlier. They do. Sometimes we see neurotoxic effects in there's a specific exposure or consumption of shellfish, and usually from marine waters. People consume them. They can get paralytic. I forget what the disease is called, but it's related to your nervous system. But that's widely observed in marine waters. But in Wisconsin, we're more dealing with fresh water, so we wouldn't see that type of illness around here. Yes, paralytic shellfish. Yeah, that's what it's called. Thank you, Amanda.
Okay, yeah, it's a little hard for me to keep up with the chat here. Yeah, I'm just going to. Okay, yeah, I'll read this out because some people may be watching the recording of this later, so I just want to make sure they get the comments. Amanda has said, for humans, illness is self-limited, but as Jordan mentioned, it can be fatal for many animals. Gina commented, bloom duration is really variable. Wind-driven accumulations may dissipate as soon as the wind direction changes. Some blooms may persist longer in nutrient-rich lakes when weather is calm. So just want to
Mhm.
put that out there for the recording so people have that information. Let's see, looking at some other questions here. Let's see, illness trends over the years. I know part of what this program at DHS does is, track information and keep a record over time. And with blooms increasing as Wisconsin gets, kind of a warmer, wetter climate. So as blooms are increasing, are we seeing illness also going up?
Yeah, that's a great question, Jennifer. So yeah, unfortunately, we currently don't understand or know the true burden of HAB-related illnesses because of the severe underreporting issue that we have. So so people could be getting sick from these blue-green algae blooms, and we're not hearing about it because they're not reporting it to us. So it's very hard to assess the health data we have for trends in terms of whether illnesses are increasing due to blooms increasing. But I think that we can assume, like, as blooms are increasing in like frequency, distribution, and severity, that this will increase the likelihood that people will be exposed and come in contact with the bloom. And if more people are being exposed, then more people are have a greater chance of getting sick. So yeah, it's a great question.
Sure. Yeah, and it's interesting too, because, as you say, like the underreporting part is interesting to me because people may not know like what happened to them if they feel kind of ill. Sometimes weird stuff happens and you rationalize it and you think, oh, I ate something strange, or I did this, or I did that. So, people may not know what happened, or they may not know where to report it to.
Mm-hmm.
So, that's why I think this presentation is really valuable, because it's one additional way to get that out there of who people can turn to if they do want help with this issue and somebody to look into it for them. Let's see, one other question I had is, early in the presentation, you talked about vulnerabilities in that slide you had, and it kind of had a little icon of a dog and a child. You talked about how, dogs are vulnerable because, they're smaller than humans. They're liable to jump in the water, as you said. They're less deterred by gross, icky, smelly things. Dogs will do things that humans won't.
Mm-hmm.
So they're vulnerable. But in terms of the human population, are you finding that kids are more affected than adults? I mean, kids obviously know when something looks icky, but they have a smaller body size than adults.
Exactly.
They're probably more likely to swallow water, if they're
Yes.
not swimmers. So, is there data, and maybe it's not at your fingertips, but I'm just curious if kids have more issues than adults or not really.
Yeah, and you are spot on, Jennifer, that kids will have a likely or have a higher likelihood of getting like being exposed to cyanotoxins because of their hand-mouth activity, and also becoming sick from their hand-mouth activity and because of their smaller body size. And actually, in terms of data, so this past year, the 2021 season, out of all the health complaints that we received, so health complaints can, once we receive a health complaint, we like assess it, determine if it's related to blue-green algae or not, and then once we do that, we look to see, okay, which ones were related to blue-green algae out of the humans and animals, and then we kind of look into those a little deeper. And we found that this past season, all of the illnesses that were determined to be related to blue-green algae were in children, all under the age of 5. So none were in adults. So
okay,
that kind of just speaks to the point of children having a higher chance of getting sick. So
okay,
yeah.
sure. I'm just going to take a look at the chat here, just trying to see if there's anything new that has come in. I think we're pretty up to date with the questions in the chat. Let's see.
Yeah, it looks like Joan was commenting about the like medical symptoms, and I believe there's a physician's guide, a blue-green algae related physician's guide. I think it's a CDC one. I'll have to double check, but we can provide that resource to Joan. It looks like she's a nurse, so
Yeah.
yeah, I can follow up with that.
Okay.
With that resource.
That sounds good. Well, let's see. Those are pretty much all the questions that I had and that I saw in the chat. One other thing occurs to me, but again, it may be too medical for your wheelhouse, because, you showed that picture of the foot rash, which is a pretty, kind of icky example of a skin contact. I mean, that looked like kind of a nasty rash. I'm sure that was not comfortable for the person who experienced that. And I'm just curious, are there ever any lasting effects from that, or does that just resolve and it's just a bad episode and then, you're healed and there's no lasting effect?
Yeah, and rashes in themselves, they're one of the illnesses that we know the least about. Actually, this past year, we've done a bunch of research and actually talked to different physicians about, their experiences with specifically dermal rashes that result from blue-green algae related illnesses, just to try and learn more. But what I know so far in from the case with the foot rash is the rash didn't end up ever coming back. It was just a rash, and then it resolved, and then it never came back. From my understanding, that's from the very limited research and literature out there. That's the typical trend that we see, but that could also depend on if people have sensitive skin or not, or like skin allergies or things like that. They might be more sensitive to, more prone to developing rashes later on. But yeah. Dermal rashes are very, very interesting.
Yeah, I've heard from a nurse that sometimes, it's really difficult to pinpoint a cause, and yeah,
exactly.
Yeah, since many things can cause rashes.
Yep.
Okay, well, let's see. I think that covers the questions that came in. Oh, let's see. We have a comment from Amanda. For rashes, we would only expect the rash to recur or worsen with repeated exposures to bloom conditions. Otherwise, it should be self-limited.
Right.
That's good to know. Yeah, that it is.
Thanks, Amanda.
Recur. Yeah, thanks for answering that. Just to clarify, that's your colleague just for the people listening to the recording, that's your colleague at DHS, correct, Jordan?
Yep, correct.
Yeah, so this. Okay. Was there anything else that you wanted to add, Jordan? I think we covered a lot of good ground here, and it's, it really shows, I think, you've used your undergraduate background in neuroscience and your grad master's in public health, to really work on this issue that kind of comes out of a personal interest for you, being from Toledo, a city that had this experience, and, but as you pointed out, is also known for many other good things. Not just harmful algal blooms. There's a lot going on there. So, well, I guess with all the questions covered, unless there's anything you wanted to add, Jordan.
Yeah, I don't think so. I guess just want to say thank you for everyone who tuned in today and listened to me talk about algae. So,
yeah,
really, it's fun to be able to apply what I've learned over the past year. I mean, I'm still kind of relatively new to this topic area, but I've learned so much in the past year, and to be able to kind of put that into a presentation and then talk about it to an audience and answer questions, like especially like medical questions like this, it's really good experience for me. So thank you everyone for tuning in, and I hope as the summer season approaches, you keep this information in mind and are aware of water conditions and things like that to stay safe. So yeah, thank you.
Yep, and yeah, thank you, Jordan, for taking time to do this tonight and share. Yep, nice comments here for you, saying great job, Jordan. I agree. So, thanks again, Jordan, and thank you especially to everybody who tuned in tonight to listen to this presentation. I can't remember if I mentioned this before, but we will put this on the YouTube channel for Wisconsin Sea Grant. So if you do want to watch any part of this again later or share it with someone keep your eye on the YouTube channel for Wisconsin Sea Grant, where we'll put up a captioned version in the near future. So thanks to everyone for being here tonight, and thanks, Jordan. I hope everybody has a great night. Bye-bye.